Thank you so much for joining. And, I'm really sure like people will be very excited to hear from you. And it's September is the PCOS Awareness Month. So, we'll have you help us bust some myths about PCOS. So I made a little introduction about you, but if you wanted to say something about yourself as well.
Do I want to say something about myself? Oh, well, I'm Tanaya. I'm a doctor. I do a lot of social media education, particularly about sexual and reproductive health, and I'm called Dr. Cutress.
Yeah, yeah, I'm pretty sure everybody really knows you already. So, starting with PCOS, actually, my first question would be, we know that PCOS is very common and a lot of people talk about it, but is it really common or is it just the diagnosis, that is a problem?
So the thing is, there's a couple of things behind it. There is some angle of, yes, the cases of PCOS have gone up. We don't know really statistically if it has gone up, or is it being diagnosed more? Because we didn't have these ultra sensitive hormone tests before this, so it wasn't diagnosed very often correctly. So there's definitely that. Then there's also the fact that now people go to the doctor if there's something wrong with their periods. पहले
Yeah,
कोई नहीं करता था. Period not
yeah,
working, okay, whatever, big shit.
yeah, yeah,
Now people do care to go. So it's like the underlying conditions that were there are now being diagnosed, and so many times PCOS is an incidental finding. People don't go there that, oh, I think I have PCOS. They go for something else, and in the test it turns out that, nah, you also have PCOS. So
yeah. Yeah, so somebody already asked the question, what is the difference between PCOS and PCOD?
no difference at all.
Yeah. So another myth, or you can tell us whether it's a myth or a fact, which is you also mentioned about the missed periods, right? So missed and irregular periods and acne are a clear sign that you have PCOS. Is this a myth or a fact?
This is a myth. I mean, you can have irregular periods for 15 reasons. You can have acne for 1500 reasons. If it's
Yeah.
just coincidentally happening at the same time, that doesn't necessarily mean PCOS. To get a diagnosis of PCOS, you must see your doctor who can see if there are other things that, that could be causing this. So, yeah.
Hmm. So somebody has asked, is weight gain a cause of PCOS?
Weight gain doesn't cause PCOS. Weight gain can interfere with your cycle a little bit. So if you feel that if you lose weight, or it's not weight loss actually, it's more exercise. If you're able to exercise and you're able to burn fat, um, that's the more important thing with PCOS. It
Hmm.
doesn't cause PCOS, but it can cause irregular periods, and it can be a consequence of having PCOS.
Okay. And then another thing is, like if you can highlight on some of the other symptoms that people with PCOS can have,
So
besides, yeah.
there's a bunch of things. Like, I like to start from the top because then it helps me remember
Hmm.
stuff better. But say
Yeah.
from the top, you'll have hair loss. People can have excessive acne. People can have excessive hair growth on their face, or maybe what is called male pattern hair growth. So that can happen. Aside from this, one thing that is seen a lot, at least in Indian people, is something that we call acanthosis nigricans. Basically, what happens is that they have a
Hmm.
lot of anxiety. There's also a link between PCOS and depression. So there's that.
Yeah. I mean, there are a lot of questions if I were to go through them actually, but I will definitely ask you a little bit more about the diagnosis part of it. So, a lot of people think that, you get an ultrasound, you see the cyst, that actually means that you have PCOS. So, how much is that true? And is that like a definitive diagnosis, criteria?
It's a very good question because I find it quite funny that people keep saying cyst, cyst, cyst. But the thing is, there are no actual cysts that happen in PCOS. They look like cysts. They're not actually cysts. Now, a cyst is just a fluid-filled cavity.
Hmm.
So if you take a balloon and you put water in it, technically, very theoretically, that's a cyst. What happens in PCOS is that the follicles or the eggs that we have, they grow so big. They
Hmm.
don't grow, not that they grow so big, but all in a regular cycle, one follicle is supposed to become sort of strong and beat out the other ones.
Yeah.
That doesn't happen in PCOS. All of them start growing, and because of that, you've got these big follicles that are there.
Hmm.
So they look like cysts, and that's why it's called polycystic ovarian syndrome.
Hmm.
So I've completely forgotten what the question was. Yes, having
Ultrasound.
cysts.
Yeah.
Having cysts does not mean PCOS, and seeing cystic things on your ovaries in an ultrasound also doesn't mean PCOS. You can have irregular cysts for any random reason.
Mm-hmm. So people are asking questions about the diagnosis and the Rotterdam criteria. I think you had a post recently about that. So, what is exactly the correct way of diagnosing PCOS?
There's three things we look for, and if any of the three things are there, if any of the two things out of those three are there, we would diagnose it as a case of
Mm-hmm.
PCOS. Now, what we see are things like, do you have any clinical features, which is like, do you have any symptoms
Mm-hmm.
that go with PCOS? Do you have any evidence that there is a raised amount of male hormones in your body?
Mm-hmm.
Do you have any evidence that there is ovulation is not happening properly in your body?
Mm-hmm.
So that means your ovary is not releasing the egg every month correctly like it
Mm-hmm.
should. Then we would, if you have any of these two symptoms, we would
Yeah.
expect this to be a case of PCOS. We
Mm-hmm.
also diagnose this using an ultrasound to sort of
Yeah.
supplement our thing.
Mm-hmm.
We do the blood test, we do the ultrasound, and depending on also sort of what your picture you're giving, how you're explaining what your cycle is, what
Mm-hmm.
your symptoms are, all of these
Mm-hmm.
things together help us come to a diagnosis of whether or not it's PCOS.
Okay, so maybe we can address this question. Do females with regular periods have PCOS?
People with regular periods can have PCOS. Irregular periods does not mean PCOS.
PCOS.
It
Yeah.
can be.
Hmm. And then there are questions around, the different types of PCOS. Like, what are the different types of PCOS? Are
Okay,
there
so
any different
this
types?
is a controversial question because in all of my experience, everywhere I've looked, I've never found any scientific literature that says that there's different kinds of PCOS.
Hmm.
If people have found it, they're very welcome to forward it to me. But these things on social media that you have adrenal PCOS or inflammatory PCOS,
Yeah, I saw
I
that.
have never ever come
Yeah.
across any real textbook literature. Even the American sort of College of Obs and Gynae, even they don't say this. So I'm not sure where this information is coming from. I will not call it misinformation because absence of information doesn't mean that it's not
Yeah.
true.
Hmm.
So yeah, I'm gonna have a look and get back to you guys on this in case I
Okay.
find something.
Okay. I'm going to ask you the next question, which is probably, I think, the very important question, which is, what is your opinion about oral contraceptive pills for PCOS?
I love the pill. Everybody knows that.
Yeah, yeah.
The pill has been very kind and wonderful to me, and I understand that's not everybody's experience. Not everybody has found the pill to be very useful for them. But what I always explain to my patients is that, say there's a big hill, okay,
Mhm.
and you have to go bike up that hill. Now you can use a regular bicycle, and you can, cycle all your way on the flat part, and then when it comes to the hill, you have to put in so much effort to cycle up.
Mhm.
Alternatively, what you can do is you can get one of those electric bikes that, when there is a uphill thing, you can turn on the motor part of the bike and it will go and take you up the hill quickly.
Uh-huh.
Now, think of a PCOS exacerbation, or when your PCOS is acting up a little bit more, think of it like the hill. Now, you can put in a lot of effort with your diet, with your lifestyle, and all other alternative things that
Mhm.
you want to do. And
Yeah.
we also need to remember that this is very ableist. Not everybody with PCOS can afford to have the right nutrition, can afford to have the right
Yeah.
exercise, and all of
Mhm.
that.
Yes.
So either you can do that, which is the cycling uphill on your own version, or you can supplement for a little while
Mhm.
and sort of give yourself a little booster pack with
Mhm.
the birth control pills or the hormonal pills.
Mhm.
They work for most people, but for
Mhm.
certain people it doesn't work. Just as with any other medicine, some medicines don't suit. So it's
Yeah,
it's just
yeah.
one of those things.
Mhm. Mhm.
So yeah, I think it's very useful, and it's really helpful, and it's really it's good for a lot of people. But if it's not working for you, then obviously that's not working for you.
Mhm. Yeah, I think oral contraceptive pills, it did really work for me. But do you think like they have any side effects? Because I hear there's a lot of buzz on social media about, if you take oral contraceptive pills for a very long time, then it could cause a lot of problems for you and so on. So is that something which you think can happen?
So a lot of people do experience side effects with oral contraceptive pills, things like mood swings, things like
Mm-hmm.
nausea, things like a lot of breast tenderness. There's a lot of things that um, there's a lot of side effects that it can have, just like any
Yeah.
other medication in the
Mm-hmm.
world.
Mm-hmm.
That said, in terms of long-term
Mm-hmm.
things, there is no risk that goes up. There is
Mm-hmm.
one of the most sensationalized studies that is published out there that says that it increases your risk of breast cancer. That was
Yeah.
done in 90 women. It's the
Uh-huh.
smallest sample size you can find, and it's very
Uh-huh.
difficult to extrapolate that information and put it on other people. One of the
Mm-hmm.
largest studies that was conducted on this was with over 150,000
Mm-hmm.
menstruators. And what they did was that they followed up people and saw if they have an increased risk of cancer.
Mm-hmm.
They did find that there was a slight increase in the amount of breast cancer, but
Mm-hmm.
there was a decrease in other cancers like ovarian cancer.
Okay. Mm-hmm.
So it sort of levels out.
Mm-hmm.
If you have a family history of breast cancer or something, then you might want to avoid it.
Mm-hmm.
But largely, going on the pill does not increase your risk for cancer.
Mm-hmm.
It also helps reduce the risk of certain cancers,
Mm-hmm.
and also, it's really helpful for a lot of people. Oh, another thing
Yeah.
is that going on the pill will not make you infertile. So you can have it for as long as you want.
Yeah.
Quitting the pill won't make you infertile.
Yeah, I can vouch for that for sure. Yeah. So, another important question is like sometimes people kind of have issues understanding like what exactly insulin resistance means and how is it linked to PCOS. So, if you can, give us some explanation about that.
Okay, so I'm going to start with how I always explain insulin resistance to everyone, which is that think of your body wearing headphones, much like me, and say that your body is making insulin. It's not that insulin is not being made anymore. It's still very much being made. But what happens is that what insulin does is it helps you metabolize sugar. It helps you keep your sugar under control. It helps
Mm-hmm.
you digest, not digest, but store it in your body or not store it in your
Mm-hmm.
body. That's kind of what the role of insulin is. And your body is still making insulin in the right way. There's
Yeah.
no there's no reduction in the amount of insulin your body is
Mm-hmm.
making. But what happens is that your body starts responding to it by just putting on headphones or stuffing its ears with cotton. So
Mm-hmm.
insulin is yelling, look at me, use me, and your body is just like, nah, not listening. And this is
Mm-hmm.
basically what insulin resistance means, that insulin is there,
Mm-hmm.
but your body is not able to respond to it.
Mm-hmm.
So it is found in PCOS. A lot of people with PCOS have insulin resistance, but it's also not that um, if you have insulin resistance, you have PCOS, or if you have
Yeah.
PCOS, you will certainly have insulin resistance. I think
Mm-hmm.
it's a thing that's found in a lot of people, but it's not like there's no direct correlation essentially.
Mm-hmm. So this is a myth that all women with insulin resistance will develop PCOS then.
That is absolutely a myth. One of the things that we are studying right now, I mean, not we as me, but like we as a collective medical and scientific fraternity,
Mm-hmm.
is that people are studying if um, the underlying reason behind PCOS is something wrong with your insulin.
Okay.
So we don't know why PCOS happens, but there's some suspicion that, the way your body metabolizes sugar or something is the underlying plot behind why PCOS is happening. And since somebody
Mm-hmm.
has asked, how do you know if you have insulin resistance? I feel like this is something important to cover. So, one
Mm-hmm.
of the most common symptoms, physical symptoms of insulin resistance, is what is called acanthosis nigricans, which is dark pigmented patches, most commonly
Mm-hmm.
seen on the back of your neck, in your
Mm-hmm.
underarms, in your groin, in the folds of your skin. So, even over here. So,
Mm-hmm.
if you're experiencing anything of this sort, please get your blood sugar tested.
So can it also happen like on the knuckles, like your finger knuckles as well? Okay.
Yes.
Okay.
So any sort of
Mm-hmm.
flexy, foldy part of skin, like the back of your neck,
Mm-hmm.
like here, like your knuckles, like the back of
Mm-hmm.
your knees.
Yeah, so somebody had also asked about the excessive hair growth, acne, which are also like common in people with PCOS. So why does those things happen, in people with PCOS?
So the amount of male hormone in our body that's normally synthesized, it increases in PCOS. This hormone is called
Mm-hmm.
testosterone, and this is why we get more hair, like hair growth on our face, on our body, and that's why we get hair loss here. Acne is also a consequence of that. So
Mm-hmm.
if you are finding that, you know, you're having too much hair growth or you're having any of these things, you can speak to your doctor and they can recommend a testosterone test. Here's another place where the oral contraceptive pills help, because they
Yes.
supplement your body with the female hormone, so to speak, that cancel out this testosterone. So your acne is controlled and your I don't know, your hairiness is controlled.
So then I'll go through like some of the myths and facts, and you can tell us about that. So first question is, PCOS can cause depression and anxiety. How true it is? How does it affect our mental health?
So the first thing is that having PCOS can be a very frustrating experience, you know. Getting diagnosed takes a very long time, then finding the right treatment takes a very long time. It's annoying, you know, let's be honest. So all of this can trigger not having your medical needs met in every which way, can trigger a lot of issues. So people with PCOS do tend to experience more mental health issues. There's also some risks that have been there's also like scientific studies have established an increased risk of having mental health issues if you are somebody who has PCOS, particularly with depression.
Yeah.
There's also something very interesting, which is that people with PCOS tend to have lower levels of vitamin D. And
Yes.
people with depression tend to have lower levels of vitamin D. So maybe there's a common link there with PCOS, vitamin D, and depression, sort of making the holy trifecta.
Yeah.
Anxiety with it is also common. PCOS itself can cause mood swings.
Yeah.
So yeah, there's a bunch of things that can go wrong, but I think it's best. That's why to treat your PCOS, the best thing to do is couple it with sort of in a multidisciplinary thing. You want to have a good nutritionist, you want to have a good exercise therapist, you want to have a good therapist who can take care of your mental health, and you want to have a good doctor as well who can sort of help you deal with the symptoms and, you know, try to control or balance your hormones.
But then another thing is that PCOS can lower your libido. So how is our sexual health affected with PCOS?
A loss of libido can, there's a bunch of things. So if you're not having the correct amount of the hormones that you're supposed to have, you can experience vaginal dryness. If there's vaginal dryness, sex can become painful. There's, you know, loss of libido. So sex is very much a mental thing as well, you know.
Yeah.
If you're not in the right mental space for it, you won't want to have it. So it's sort of it's so multi-systemic in its involvement that it attacks every part of your body almost.
Yeah.
That's why if you are somebody that's experiencing libido loss with PCOS, you can speak to your doctor who can either give you a lubricant that can help, you know, get rid of the inherent dryness that can stop making sex painful. You can speak to your doctor about getting medication for it.
Yeah.
Certain people who have insulin resistance or don't metabolize sugar in the right way, they can also have nerve damage. So there can be issues with that. You can feel a sort of less sensation because of that, because your nerves are slightly more damaged. And, you know, there's a whole bunch of things basically. Which is why you need a multidisciplinary team to help treat or manage your PCOS.
So another thing is now, since a lot of people are also asking about the weight, so is it a myth or a fact that if you lose weight, you can reverse PCOS?
Reverse PCOS is a very loaded term.
Yes.
Can you reverse hypertension?
Yeah.
You know, if somebody has hypertension, can you just say, oh, you know, stop eating salt and you'll reverse your hypertension? I don't know what reversing your PCOS means. You can keep your PCOS under control. It's the same thing as having hypertension or diabetes. You know, you can do things that help keep your diabetes under control. You can even get it so much under control that you can go off medication. But I don't know what reversing means. I kind of keep getting stuck on that.
No, I think like this is also kind of a myth or a fact. So the first is like, can you actually reverse your PCOS, or is it like something?
What does reversing even mean?
So no, right? So because a lot of people, you know, keep on asking like, can my PCOS be cured, and like, can I get rid of PCOS and so on. So ideally, it's mostly like you can manage it, right? But
you can
cannot,
definitely manage your PCOS with a bunch of things you can do. You can take care of your health in terms of your nutrition, your exercise, your sleep, your stress, all of these things. But it's a lifelong thing. If anybody is telling you they're going to cure your PCOS, run the other way. They're going to scam you out of your money. It's you can't cure PCOS.
So another thing is about fertility, and I see a lot of questions for fertility as well. So of course, like one of the biggest myths which I also have encountered is like women with PCOS cannot conceive naturally at all. So, they are just like infertile.
So many people who didn't even know have PCOS have babies.
Yeah.
And then, it's just an incidental finding that they're like, actually, I have PCOS. Okay, cool, whatever. So PCOS, yes, can cause issues with conceiving for certain people, but PCOS is not equal to infertility. It's a bunch of things. There can be different things that are going wrong. Certain people might find that they're ovulating all right, but they're still making too much male hormones. Some people might find that they're not making enough male hormones. Some people might find them both of those things are wrong. Some people might find that there's a bajillion reasons how your PCOS can affect your fertility. But the treatment or the management of this is very patient centric, and it's very centric to what your problem is. So I think it's very difficult to give common or generalized or blanket advice on this. But that said, that again, I want to very strongly emphasize that PCOS does not mean infertility.
Okay.
You can speak to your doctor, they can help tackle, and PCOS, infertility is not just a woman's issue essentially.
Yeah.
40% of all infertility can come from the female thing. 40% of infertility can come from the male factor, and that's something very important that we tend to ignore. So yeah, there can be so many ways you can tackle it.
Yeah.
You can't get rid of your PCOS, you can just manage it, and that can help you improve your chances of conceiving.
Okay. And then another thing is myth or a fact, you can tell us if pregnancy cures PCOS.
No.
No. Okay. And then there's another thing which is, I see that a lot. Women with PCOS, they have difficulty breastfeeding. And a lot of people say that, if you have PCOS, you will have low milk supply.
So this is a new area of research, and people are finding that there is an association with with people who have PCOS and finding low milk supply. Now, there's something very important in medicine that's called causation versus correlation. In science, sorry, not medicine. Which is basically that just because two things are related doesn't mean they're being caused by the other thing. A very good example to illustrate this is, yes. So, there's a stat that says that in the summers, people have a lot of ice cream. Now, this is common sense, right? Yeah. There's also this stat that there are more shark attacks in the summers because, more people go to the beach. At the beach, you're more likely to go into shark-infested water and you might get attacked. Now, these two things are related. That because it's summertime, you're eating more ice cream, and because it's summertime, you're going more in the water, so therefore more shark attacks are happening. This is a correlation, okay? But some crazy science journalist who doesn't know what science journalism means will go and interpret this and say, eating ice cream causes shark attacks. That's causation. So these are just correlated things. They're not being caused by, one is not being caused by the other. So that's very, very important to understand. And with the low milk supply in PCOS, we don't know if it's causation versus correlation, or if it is genuinely something with the PCOS that's triggering the low milk supply. We're still studying it, to be very honest. Okay. There's so much we don't know about it because women's health doesn't get money. Let's be honest. कुछ नहीं मिलता है. अब कुछ आया है, but otherwise there's no money in women's health. Very sad thing. Yeah, I'm at least glad that there's a lot of information now, at least on social media. Yeah, so that's good. So another a lot of misinformation as well, unfortunately. Yeah, but then we have you, so that's why people follow you to get all the right information. So another thing is which is very common. People with PCOS generally have hypothyroidism. So are they kind of related to each other? There's no direct link. Again, it could be causation versus correlation. It could just be that because your endocrine profile, which is your hormonal profile, is generally disturbed. So they can be sort of links, but there's no hypothyroidism causes PCOS or PCOS causes hypothyroidism. Also,
Okay.
hypothyroidism is really common in our country, like
Yeah.
really ridiculously common. So
Yeah, yeah.
it's just an incidental thing.
Uh-huh. Okay. And then I think one of the myth and fact question is like if you are stuck with PCOS or if you have PCOS, you will have it for the rest of your life. So, I just want to know, how does a manageable PCOS look like?
Get good sleep. This is extremely important. Um, this is one of the things that tends to keep getting ignored. People are just like, oh, exercise and nutrition, exercise and nutrition. What about sleep? Yeah. Maintaining the right sleep rhythm is very important, and getting good quality sleep is also very important. And unfortunately, PCOS can also interfere with your quality of sleep. So you can speak to somebody for um, helping manage that. Therapy can be
Mm-hmm.
very helpful in that. I am a strong believer that everybody should get therapy. So more so if you have PCOS.
Yeah.
So there's you can sort of manage that aspect, and along with that you can also manage your stress aspect. So
Yeah.
sleep, stress, food, and exercise,
Mm-hmm.
these are your golden touch points for managing your PCOS well.
Mm-hmm. So once
It's not
yeah, go ahead.
sorry
No, no, go ahead.
it's not weight loss that's the focus, it's getting more
Yeah.
exercise that's the focus. It
Mm-hmm.
doesn't matter if you're whatever weight you are, just focus on getting more exercise. Don't resort to unhealthy eating patterns to lose weight, so to speak.
Yeah.
You can be very healthy and still be heavy because say you have heavy bones, or you just deposit fat in your body differently.
Mm-hmm.
There's a billion things.
Yeah. So once you are able to like manage your PCOS, like what are the things that will surely tell you that you are able to manage it? Is it just like through blood tests and everything, or you are healthy, or like what is the way?
It depends on what's going wrong. So, for example, if you have irregular periods, your periods might regularize. If you have excessive hair, that might automatically manage itself. If depends on what the underlying problem is, you will see an obvious improvement in the problem, and that's how you can know that your PCOS is being managed. Aside from this, you can also, of course, go for your tests. You can go for blood work. You can go for ultrasounds. So, yeah.
Okay. So I think will take some of the questions. Is it okay for you? I'll just take
Yeah,
like some
yeah,
of
by all
the,
means.
yeah. So just does PCOS later on cause insulin resistance or lead to diabetes?
So there is a very strong link between having PCOS and developing diabetes later on. Because one of the things that happens in PCOS, or one of the things that causes PCOS, is insulin resistance. We don't know. And insulin resistance is also a feature of diabetes. So if you have PCOS, you have to be very careful in monitoring your blood sugar and being careful about your food intake, basically.
And then there are some people asking about how high prolactin levels are related to PCOS.
Yeah, prolactin. Why we test for prolactin when testing for PCOS is because excessive prolactin can also trigger irregular periods. But if there's a direct relationship between high prolactin and PCOS, I wouldn't know about it. I can read up and get back. But PCOS by itself should not cause high prolactin. It can
Okay.
be a coincidental thing that, like just, like you have thyroid issues, you can have prolactin issues as well. Thyroid and prolactin issues can be linked.
Okay. Okay.
But not about PCOS, not that I'm aware of.
Okay. And somebody has asked if PCOS is a symptom of genetic disease.
So we don't know if it's 100%. Again, like, unfortunately, the answers are so stupid. A lot of times I just end up saying we don't know because we haven't studied this
Yeah.
shit enough. It's so infuriating.
Yeah.
So there is a genetic component, but that doesn't mean that if your sister has PCOS, you'll definitely have it. It's being
Yeah.
investigated right now.
Okay.
There's a very good question by Disha NGL that I would like to take up,
Yeah,
which
yeah,
is, do you
sure.
need to avoid dairy products? And the big fat answer is no, you don't need to cut out any food group in your life. There is no scientific evidence that cutting out dairy or gluten is helpful in managing PCOS. It can help you manage your diet in general. If you find that dairy is a trigger for you and you tend to overeat or binge on that, then sure, feel free to cut it out. But cutting out dairy or gluten or any other food group is not going to help your PCOS directly in any way.
I mean, is it better
Sure.
to actually, for you to actually tell us about the myths, like which you think are the biggest myths that people ask you all the time? Because then there are lots of them. Is bleeding. Yeah, I mean some of them
Okay, I'm going to cover
pregnancy.
three.
Yeah,
The
yeah.
first is that are PCOS and PCOD the same thing? Yes, they're the same thing. Don't read that stupid Times of India article. PCOS and PCOD are the same thing. There is no difference. It was called PCOD before, but disease is a very stigmatizing term. It makes people feel bad. I have a disease. It's a syndrome.
Mm-hmm.
That's it. There's just been a language update. PCOS and PCOD are the same thing. PCOS and PCOD are the same thing. PCOS and PCOD are the same thing. The
Okay.
second is that the birth control pills that you take, or the hormonal pills you take for PCOS, are perfectly safe for use, and
Mm-hmm.
if it works for you, excellent.
Mm-hmm.
If it doesn't work for you, skip it, go for something else. But they're not harmful. They will not affect your fertility in the long run, and you can very well have your birth control pills. They will not make your body dependent and what have you, what nonsense that comes up.
Mm-hmm.
Okay. And
Yeah, and then all.
okay, yes, seed
Yeah,
cycling. I think
yeah.
that's a very common question that tends to come in. Why is my video stuck? Yes. Um, a lot of people say seed cycling will help manage your cycles better. We don't have enough evidence on this. Maybe it helps, maybe it doesn't. If it works for you, keep doing it. But according to all the scientific evidence, yeah, not sure
Mm-hmm.
if there's any difference.
Okay.
I mean,
Okay.
having seeds are good in general. You know, they have very good amino acids. They have very good fats.
Mm-hmm.
They're very good essential vitamins and minerals. So go for it. It's not unhealthy, but it's also
Mm-hmm.
not going to cure your PCOS.
Mm-hmm. So I see a lot of people ask question about the blood test that their doctors haven't done blood tests and so on. So is there a time when you should do your blood test during your menstrual cycle, or for the correct diagnosis?
So your doctor may not necessarily ask you for a blood test, because we need to fulfill two criteria out of three. And if
Yeah.
they're saying that, if they're seeing that you're having obvious clinical symptoms of PCOS, and on an ultrasound they're seeing there's many cyst-like things, there's two criteria already fulfilled. They don't need to do the test. They might recommend it anyway.
Mm-hmm.
You want to do it on the day 2 or day 3 of your cycle. That's
Mm-hmm.
important, because you want to get the baseline levels.
Mm-hmm.
Because as we go through our period, our hormones go up and down, and getting it done at another time will give you a false high result, and
Yeah.
you'll freak out and you'll be
Mm-hmm.
like, oh my god, what is happening? So yeah, we need
Mm-hmm.
to do it
Okay.
on day 2 or 3.
Mm-hmm. Yeah, thank you all for joining, and thank you, Dr. Cutress, Dr. Tanya, for taking out the time
Tanaya.
to do Tanya, for taking out the
Thank you,
time to do
Divya.
this. Yeah, thank you.
Well, this brings me to the end of this video. Thank you for watching. If you like the video, subscribe to my YouTube channel, Quick Mommy Hacks, and follow me on Instagram.